but I think that wasn't it. Oh, we're on YouTube now. Okay, cool.
Thanks for going off camera a bunch. My allergies are really bad and I've been sneezing a lot.
Oh,
Please.
That's what I get for sleeping with the windows open a couple nights ago. I knew I shouldn't do it.
oh man, I'm with you on that one. I was sneezing up a storm. It was so windy. Oh,
Friday.
Cool.
And I think Nick was.
I don't know if it's just me or Stacy, if you can hear it. Jess, your audio sounds a little crackly.
Yeah, Jess, can't hear you, Jess.
Morning, Bennett.
Good morning.
So does that trip feel like a distant memory now, Bennett, or is it still with you?
Good question. A little bit of both. I still think about it sometimes throughout the day,
Yeah,
but life goes on.
it does. Good morning, John. Andy, hello. Jeremy, oh my goodness, everybody's coming in fast and furious now. Courtney, good morning. Let's see. So Jessica, I'm counting 8. We need 12 for a quorum.
Yep, just wait. Welcome,
Yep.
everyone. Happy Monday.
Morning.
Morning, Caroline.
Good morning. Getting everything all set up.
I hear you. Doing the same. Good morning, Guthrie.
Then Greg. Yes.
We can hear you
Okay,
now.
just dial in. Kari was having trouble getting into the meeting, so I'm going to resend, or I'm going to email everyone again and tell them to use the link that came in the meeting invitation
Very good.
in case folks are having trouble again.
I think we got 12, though. Jessica?
That's correct. We do. I think we officially have a quorum if we want to get started.
Whoop, whoop. All right. Just let us know when you're ready, okay?
Uh-huh.
Is that a uh-huh, I'm ready, or a uh-huh, I'm...
Just give me a second. All right, I'm ready.
Excellent. Well, Jessica, if you're ready, I can go ahead and get us started.
Sounds good. Thanks.
Excellent. Welcome, everyone. Welcome to the October 7th Psychedelic Medicine Task Force meeting. We're glad you're here. We've got just some standard stuff to take care of. Jess, if I can get you to slide over to the next slide, we'll take care of some of that basic business that we do every time. And I know some of you members are old hands at this, but we do have a couple new ones. So just some reminders for the newer members. How you navigate on the platform we're using today is here on the screen. I'm assuming you've tested all of your Zoom settings and are old pros at that. The mural link, and you will want to be on mural today. It was sent to you in the email that Jess sent out was it Friday? So go there. If you don't remember the password is there too. So go ahead and make sure that you've got everything set to go on your own screens. Maybe get mural up and minimized, whatever you need to do. And Jess, if you could slide over to the next slide, please. And then if I could have you also just take the outline down, if you could. Thank you. All right, task force. I'm here as Stacy Sjogren. I'm a senior consultant with the rest of the MAD crew, Jessica Burke and Nick Core. I help Jessica Nielsen, Dr. Nielsen, our chair, to facilitate these meetings here. So you'll hear my voice now and again. And in terms of the task force leadership itself, of course, Dr. Jessica Nielsen is the chair, Bennett Hartz is the vice chair, and Paula DeSanto has been serving as the work group chair. On the MDH staff side, we've got Carrie Glopin, who is the epidemiologist supervisor for Injury and Violence Prevention Section, and Dr. Caroline Johnson, with whom you've heard quite a lot, doing a lot of our data research and taking the lead on report writing with help from so many of you. And I'll take the next slide, please. And a message to our meeting observers. First and foremost, we're so glad you're here. We appreciate that you're interested in this and the work of the group. This meeting is being live streamed on YouTube, which means that you can watch the meeting. Certainly can't participate in it in terms of making comment, getting involved with chat, even though for members, we don't use chat. We prefer to verbalize any comments because we want to be transparent for our public. So while the meeting is being live streamed on YouTube, if you want to follow up and look at the results of the meeting, you'd want to go and look at the minutes that will be posted on the task force's website, along with any other materials for this meeting, and you can go ahead and look at the links at the bottom of this slide. And I'll take the next slide, please. The legislative charge for the Psychedelic Medicine Task Force is that it was established to advise the legislature on the legal, medical, and policy issues associated with the legalization of psychedelic medicine in the state. For purposes of this work, psychedelic medicine means MDMA, psilocybin, there it is, and LSD. Next slide, please. And we've got two slides here that outline a bit more about the legislative charge, primarily scientific research, gathering the scientific studies that exist, and in terms of therapeutic efficacy of psychedelic medicine in the treatment of mental health conditions, including depression, anxiety, post-traumatic stress disorder, bipolar disorder, and any other mental health conditions and medical conditions for which the psychedelic medicine may provide an effective treatment option. And secondly, to compare the efficacy of psychedelic medicine in treating the conditions described above with the efficacy of treatments currently used for these conditions. And next slide. That's several duties. I'm not going to read through all of these right now, but suffice it to say, it's to develop a comprehensive plan for the legislature to consider. And I'll have you go to the next slide. Whoop. I think our outline got a little wonky. Hang tight. There we go. Okay, if you can hang tight there, that'd be just fine. Jessica, I think I'm ready to turn it over to you to go through some of the basic task force business. You want to take it from here?
Yeah, sounds good. Do we want to do a roll call first?
We can certainly do roll call first.
Okay.
And I've not been looking at participant list right now, but it seems just the numbers are growing. So yay, everyone, we're glad you're here. And give me a sec, we need to pull over my tracking document. And let's see what we've got. Courtney Amundsen, are you here, Courtney?
Here.
Good morning. Helen Bassett.
Hey.
Helen, are you here?
Good morning. Yes.
Good morning, Helen. Guthrie Capsella.
Good morning.
Good morning. John Connolly. John is replacing David Hong over at DHS, by the way. I'm not sure if you've had a chance to formally introduce yourself, John.
Yeah, President. Thank you, Stacy. John Connolly, Assistant Commissioner for Healthcare and State Medicaid Director at DHS.
Hey, good to have you with us, John. And Paula DeSanto is absent today, everyone. Jeremy Drucker. Jeremy, are you here?
I'm here.
Oh, good morning, Jeremy. And what about Stefan? Stefan Egan. He was not sure if he was able to attend yet. Let's see if he was able to get through some of the technical issues he had going on. Stefan? Okay, Mad Team, if you'll help me keep an eye open for Stefan so we can change his attendance if he does, if he is able to get on this morning.
We do have someone on the list who doesn't have a name.
That's, I think that's Jill.
Oh, is that Jill?
Hey, I'm sorry. I'm on a new laptop. My apologies. I don't
No,
No
I will
worries,
change
Jill.
your name. No worries. Thanks, Jill.
We're just glad you're here, Jill.
Okay.
Margaret, Gavion, Margaret, are you here?
Hi, I am. Good morning.
Good morning. Bennett, I know you're here, but let me hear your voice.
Present.
Excellent. Senator Mark Coran.
I'm present.
Hey, Mark. Nick Leonards. Nick, are you here? All right. Ari McHenry?
I'm present. Sorry about that.
No worries. Glad you're here, Ari. And Jessica Nielsen.
Here.
Kit O'Neill.
Here.
Morning, Kit. Jill Phillips. Try it again, Jill.
Here, present. Thank you. Sorry. Good morning.
And I think Ken Sass was going to be absent, but let me just check and see. Ken, are you here? All right. Donovan Souther. Donovan?
Here.
Good morning. Representative Andy Smith. Andy, are you here?
I'm here. Good morning.
Good morning. Michael Tabor.
Here. Good morning.
Morning. Adam Tomsick.
Here. Thank you.
Good morning. Ranji Verghese.
I'm here. Good morning.
Good morning. And Representative Nolan West.
Present.
Well, good morning, everybody. We have got excellent turnout here, everyone. Thank you so much. And
Nick Leonards is on the participant list now.
is he? Oh, excellent. Nick, can I hear your voice?
Yeah, you bet. Can you hear me?
We can. Thanks.
Okay, great.
Good
You bet.
All right. Back over to you. We can go ahead officially.
Great. Thanks, Stacey. And thanks to all the members for attending. And thanks to people on YouTube for watching. I do want to give an opportunity for our two newest members to introduce themselves and anything you want to say. I know Senator Mark Coran, we didn't really get a chance to hear from you much last week in terms of you introducing yourself. So I wanted to give you the opportunity to say to come on camera and introduce yourself officially to the task force. All right, I'll move over to John Connolly if you want to introduce yourself. Welcome to the task force.
Thank you, Jessica. Yeah, so again, Assistant Commissioner and State Medicaid Director at the Department of Human Services, and we contain or oversee the medical assistance and Minnesota care programs in that portion of DHS. So glad to be here and to work with you all.
Great, thanks for coming in at kind of the 11th hour. We're on our 12th meeting. We just have a few more of these to go. So thank you, everyone. Try one more time. Senator Mark Coran, do you want to come on camera and introduce yourself?
Hi, everybody. State Senator Mark Coran represents Senate District 28, Chisago and Iceni counties.
Great, thanks. Welcome, both of you. All right, Jess, can we get the agenda up on the screen and we can kind of go over what our objectives are for today's meeting?
Can you all not see it?
I just see the Zoom attendees. I don't think the screen's being shared.
Okay, hang on. I'm going to stop sharing and start it again.
Let's see if I can pull up the agenda. So first we want to approve the September meeting minutes. So hopefully everybody has seen those meeting minutes and had a chance to review them. And we'll do a vote by roll call to approve those minutes. Then we're going to do some member collected feedback. So each of you, if you've had chances to connect with your agencies or your communities or your constituencies, this is the opportunity to share that now with the public and the other task force members. We'll then go on to talking about kind of how we're making some decisions and how we're preparing everything for voting on 2 more recommendations today that we're going to put in our final report. And then we're going to have some discussions around the actual task force development. And so, yeah, so first, hopefully everybody has had a chance to read the meeting minutes. And so do I have a motion, Jess? Yeah.
The meeting minutes that went out on Friday do not have the DHS votes in them. I don't know if we want to wait to approve them or approve them conditionally, you know, based on adding that information. I don't know what the task force wants to do there.
So this might be an interesting point of discussion. So, you know, we have the meeting minutes of what actually transpired at the meeting, and then there's sort of these lingering questions because we didn't have the DHS vote, so we couldn't finalize some of the recommendations because they were kind of hanging on the edge of whether we had a supermajority or not. So what do folks think about that? Want to open it up for discussion on how folks think about approving the meeting minutes now or waiting until next month when we actually have the vote tallies.
I say wait.
All right, does anyone else feel the same?
Sorry, I was struggling there. This is Adam Tomczyk. Yeah, I think we should wait until we have the full vote so that the minutes are complete. That would be my position.
That makes sense to me.
I agree.
So in terms of, would we go through a vote by roll call and people would say no, or should we just table it until next month?
I think you can just go ahead by acclamation because what you're hearing is a sense of the group to wait until next month. So I think as long as you say that loud and clear, we'd be fine.
Great. Okay, cool. All right. Well, now we'll go to member collected feedback. So if anybody has anything to share, I'll start. So I do regular listening sessions every month with the community, mostly the psychedelic community. And, I've just been hearing a lot of questions around education and people wanting to understand the law and what do psychedelics do to the brain? What is their therapeutic potential? What does the science actually say? So I put together a video that I've put up on the Psychedelic Society of Minnesota's YouTube channel. That's sort of a kind of a deep dive into some of these topics from an educational perspective to get ahead of public education. But I do want to hear from other folks and what you're hearing from your communities or from your perspective around what we're doing with the Psychedelic Medicine Task Force. Anyone have anything to share? Yeah, Renji?
Thanks, Jessica. Yeah, in our last meeting, we had mentioned sharing some community feedback, and I had sent surveys to practitioners that are practicing in the state of Minnesota, both that have a psychiatric focus and those that are non-psychiatrists. I received a total of 43 surveys or responses back. That information will be compiled and has been compiled. I've sent it to Mike Tabor, and we'll have that in our final manuscript. But the general consensus was that most providers, this included both psychiatrists, physician assistants, nurse practitioners, training residents that are both in, again, the psychiatric field and then in the non-psychiatry fields, are generally supportive of exploring these molecules as tools to perhaps help with mental health. But there's cautious optimism, but there's real concerns about their potential safety and how that would be rolled out and how people would be, one, screened, selected for, supported, and then who would sort of monitor that. But the details of that will go into the final manuscript, but I just wanted to let you know that we did receive 43 surveys back. Doesn't sound a lot, but that's a lot when you're sending it out to people that are exceedingly busy. So, but I think there was a final response or a general idea of how people are thinking, at least in these medical specialties and non-medical specialties.
Thanks, Renji. Did anyone happen to talk about, Renji, with your group and your community feedback issues around DEA registrations and any kind of programs that might pop up and how to safeguard that?
That wasn't part of one of the questions. It's just, well, it's not on their radar, so I didn't get any specific questions on how that would work out. But I'm sure that once people understand that this is not going to be easily prescribed unless the DEA lifts their scheduling, I'm going to guarantee you that no one in the state of Minnesota who does not have a DEA, schedule license 1, which is only for, research, will want to put their license on the line. So we really do have to think that through.
Yeah, thank you. It's a big question. All right. Anyone else have any things they want to share at this time with us from your community?
I'm not seeing any other hands raised right now.
That's fine. So we'll move on. So next, if we could get the slides back up, I'm just going to kind of go over, give us a kind of summary of where we're at, kind of a high-level review of our work cadence, our decision flow chart, and our progress towards the legislative charge. So most of you have seen this many, many times. It's just kind of a gnarly high-level overview of our entire work that we've been doing from start to finish since we first started meeting around November of last year. Next slide, please. And just sort of kind of zooming in on where we are now. We're in report writing phase. We're drafting the report right now. We're finalizing our recommendations so that we can submit our report to the legislature by the due date of January 1st, 2025. Next slide, please. I think one more to the left. So I think there's one more slide before this. So I've tried to put together the information that we've learned in a very high-level summary, just to kind of see like where we're at, how does this fit into our legislative duties for the task force. So one of the legislative duties was around exploring the scientific research and understanding what are the medical value of psychedelic medicines, what's the status of the clinical trials. So this has been done very diligently and comprehensively by Dr. Caroline Johnson. And so what we found, even though there are some limitations with the way that psychedelic clinical trials are run and the conclusions that can be made, we are finding that they perform as well or slightly better than current options for treatment for mental health conditions in placebo-controlled clinical trials. However, psychedelic medicine trials have been too small in kind of the number of people that they're treating to compare to the much larger trials that have been done with some of the standard lines of treatment with antidepressants and things like that. So this issue of trying to look at efficacy, which is how does this drug compare to an inert placebo? That's notably tricky with psychedelics, but it's not unique to psychedelics because the experience of the drug itself is so intense that it's hard to blind, so people don't know what they're getting. And then this issue of effectiveness is really trying to see how good is it in this context of what we're looking at. How good is it compared to other treatments? So is it performing better? Is it more effective than what is currently available to people? And I think some of the data is suggesting it might be, but again, there's this large discrepancy in how many people have actually been looked at in these trials, and there might be more data that's needed to really get a thorough, comprehensive comparison that's kind of a one-to-one comparison of those, what we call effect sizes. How well does the treatment work in reducing symptoms? But based on that, we are showing some indications that MDMA shows promise for PTSD, with other studies looking at alcohol abuse and social anxiety. Psilocybin might be showing some promise for depression, as well as alcohol use disorder, with other studies looking at tobacco abuse, PTSD, cluster headaches, OCD, and palliative care. LSD shows promise for anxiety disorders, with other studies looking at alcohol abuse, cluster headaches, depression, and palliative care. Next slide, please. So that covers sort of the first two duties in the legislation. The next is sort of these comprehensive plans that we have to develop. And one is around how do we resolve federal conflicts, given that all of these things are on the Schedule 1 of the Controlled Substances Act, and so they're federally illegal. And so I've tried to break this down into a table here to kind of show how the different recommendations that we're writing about in the report could be handled, how they could be implemented, and what can we do to resolve any federal conflicts should something come through. And we need to kind of mitigate this. And knowing that we do kind of have a precedent for this with cannabis, but psychedelics are not cannabis, but they are both currently on Schedule 1. So in terms of just the first recommendations, the first set of recommendations around removing criminal penalties, which we're going to talk about more today and vote on. So this is basically just not enforcing of the Federal Controlled Substances Act. It's something that states could do by invoking the Anti-Commandeering Act, which falls under the 10th Amendment right of the Constitution around state autonomy and state rights. Ways to implement that include changing the statute of the State Controlled Substances Act, allowing and allocating and disseminating resources for harm reduction, and ongoing education and training of the community and providers and anyone that's sort of going to be encountering any of these medicines if there are removal of criminal penalties, but there needs to be some sort of safety net in place if that were to happen. In terms of more research trials, this is already federally legal. There's already a path for this. It's not anything that we would be in conflict if we were to pursue that. It's really just an issue of who would run the trials, who would be authorized to do it, who's going to get these DEA licenses to conduct this research so that, they can possess and distribute these controlled substances in a research setting. Are there any institutions that we want to limit these to, or do we want it to be more broad? And it's really more about creating a funding mechanism and probably advisory panels and review boards around what would get funded and how would the research be conducted. And so there's already a lot of infrastructure in place for doing this. It's just really more about allocating the resources to make it more feasible and possible. And then also issues of public safety around this would be just, again, ongoing education and training for researchers and interested trial participants and their communities. Education of the public on this is extremely important because I think there's a lot of confusion in the public around what clinical trials are and what it means to be in a clinical trial, because it isn't therapy, it's actually a science experiment. So I think helping manage the expectations of the public, if that were to happen, will be crucial. Just from my perspective, trying to recruit for my psilocybin trials and just seeing the demand, it was really intense. And yeah. So next, if we have a state regulated clinical program, which one of our recommendations passed with mushrooms. So this is not federally legal, but we could potentially request exemptions to the Controlled Substances Act by doing a formal administrative request to the DEA. To my knowledge, this hasn't been done or been successfully achieved. So it's unclear if that would work, but that is a potential option that is there that's sort of written in statute that you could do at the federal level. We could also try to use the Right to Try Act or expanded access. These are expanded access as a type of clinical trial, but it's a way for a physician to decide, do I want to give my patient this treatment? It's kind of similar to Right to Try. They have some notable differences. Right to Try is not a clinical trial. It's just a right that people should have, but there's some weird restrictions around whether it can be used for Schedule 1 drugs, and this is currently being litigated in the Ninth Circuit Court of Appeals. So we're waiting on a decision on that, on whether that's going to be allowed. And that could change kind of what we're thinking about with this one. But ways to implement would be to, have an agency or put this in kind of another department within the state to develop rules and regulations around medicine sourcing, experience facilitation, safety screening, monitoring, training, things like that. And again, to get ahead of public safety, we would want to focus on education and training for facilitators, any cultivators that would be supplying psilocybin mushrooms, and any interested clients or patients that want to engage with the program. And then finally, and this one is just sort of one we've been discussing, it hasn't passed as a recommendation, but it's something we're going to include just kind of as like a potential endpoint of where things might go in the future. Adult regulated use of psilocybin containing mushrooms. Again, this is not federally legal, but in order to resolve federal conflicts, we could again request exemptions to the Controlled Substances Act to implement a state program, invoke the 10th Amendment right, and also just not going out of our way to violate any other federal laws, such as interstate commerce, which would put us in the crosshairs of the Federal Trade Commission. So just kind of things like that could be possible. We could implement this by, as we did with the adult regulated use cannabis program, allow and regulate a legal industry with psilocybin mushrooms. And public safety would involve regulation, so people know what they're getting. People aren't being sold things that don't have what they say they are, like we're seeing with these diamond shrooms and other kind of mushroom edibles that don't have known contents in them and are causing kind of really serious adverse side effects. Having education and training across the state, similar to we do with alcohol and cannabis, to make sure these things are being regulated and kind of kept in the hands of adults and not being diverted to children. So those are just some things to think about. Next slide, I don't know if I have more on this. I think the next piece that we have to talk about is developing these comprehensive plans for statutory changes and regulations on the proposed recommendations. So I've been doing a deep dive in the different state statutes and trying to figure out what different things would be hit upon with these recommendations that might need to be amended in any bills that would implement some of these recommendations. So these are just a few that I found. I think there's a lot of work that needs to be done in really figuring out what all these statutory changes are. And I have questions for the legislators around how much we need to put in the report versus stuff that House or Senate research might find in a bill. But some of them that just seem kind of obvious to me were obviously the statute related to the States Controlled Substances Act, regulations around examining and licensing boards, data collection and privacy. There might be some discussion if there's work to continue with psychedelic medicines, that maybe it's something that would be more appropriate under the Office of Cannabis Management, because they've also moved the Office of Medical Cannabis over there. So there might be some statutory changes there. We might want to amend our own State Right to Try Act. Right now, it doesn't exclude Schedule I drugs, but it does exclude anyone that's not terminal. So someone has to be, I don't know if it's just for end-of-life care or hospice, but we might want to change that if we want to be able to use it more broadly for things like palliative care, which is really about providing comfort for people with chronic conditions. There's also statutes related to shifting authority of agencies if that's necessary. If there's going to be mushroom supplies being grown in the state, there's the farm product dealers that helps with that. So those are just some examples I've been able to find. And then the public education piece, I think, is the most central to all of this, because I think everyone needs some education on this. So thinking about things like Psychedelics 101, history of indigenous uses and ongoing consultation, status of the science and research, legal status across the state, the country, and internationally, training for first responders and clinicians on psychedelic crisis intervention, education for parents and teachers, youth outreach and education, religious uses in churches, best practices related to using and supporting communities using psychedelic medicines and other adjacent communities to psychedelics, and then intersecting government groups, relationships with the media, because they tend to overhype things that can be a bit of a problem. So I think that's good to make sure that that's being communicated well to the media on anything that's happening. And again, these are just examples that we're trying to develop. And a lot of these came from all of you in our mural activities around what we want to focus on in terms of public education. So next slide, please. So just a brief rundown of what's happening in other states, which I think kind of helps what we're doing. Obviously, every state's different. Every state has their own comfort with what they're willing to allow and how much conflict they're willing to be with the federal government. But just a few things of note that have been happening. So kind of an obscure fact that doesn't get talked about much, but New Mexico has actually allowed home cultivation for personal use of psilocybin mushrooms since 2005, and it hasn't really been an issue. They're not allowed to share or give it to other people, but they are allowed to grow it in their own home. There's local deprioritization that's happened across the country in a lot of different kind of city municipalities where it remains illegal, but policies allow certain activities around engaging with different psychedelics. It's usually around the naturally derived psychedelics. So many cities, these include California, Washington, Massachusetts, Colorado, Maine, Minnesota. We have that in Minneapolis here. I've heard rumor that it's happened in Duluth, but I haven't seen anything. But there might be a couple cities here in Minnesota that have done this now, Michigan and Washington, D.C. Obviously, Oregon passed Measure 109, which was a ballot initiative in 2020, creating a psilocybin service industry that launched in the summer of 2023. And they've seen, I think the numbers are like over 5,000 clients have come in through those service centers in just the year that it's been open. They also passed Measure 110 through a ballot initiative that same year to decriminalize all drug use and possession. But this was repealed through the legislature in 2024 due to some complications with fentanyl and the opioid crisis, and it wasn't really related to decriminalizing any of the psychedelics. Colorado passed the Natural Medicine Health Act, Prop 122, in 2022, creating treatment centers and allowing for community peer support and decriminalized use and possession, with service centers set to launch in 2025. Utah also passed this last year, SB 0266, which was also legislature approved, that allows breakthrough therapy. So breakthrough therapies are any therapy that the FDA has granted to a pharmaceutical company where they've kind of designated this, there's something really promising about this. We're going to help you move this through the clinical trial process. And so they do this a few times. So they've done it for LSD, MDMA, and psilocybin. So in Utah, if something has been granted breakthrough therapy status by the FDA, they're allowed to use it in one of 2 of their hospital systems that are throughout the state. And it's a time-limited program that expires on July 1st. But their program is proposing to use the synthetic versions of these things without leveraging the pharmaceutical company's drug supply. So it's unclear how they'll actually source their psychedelic medicines in the state without being able to use the kind of DEA approved supply that pharmaceutical companies have. So that'll be interesting to watch and see how that unfolds. And then upcoming in November on a ballot measure in Massachusetts will be this question 4, which is, again, another ballot initiative to legalize and regulate natural psychedelics. So we'll find more about that after the election next month. Next slide, please. Okay, and then this is just some sort of noteworthy updates that impact our work. Oh, it's kind of muted. So the first is that the Department of Health and Human Services, or HHS, so this is sort of the parent arm of the Food and Drug Administration. So they modified the way that they consider accepted medical use when making rescheduling recommendations to the Drug Enforcement Administration. So they recommended scheduling cannabis from Schedule 1 to Schedule 3 due to accepted medical use across many states and the safety profile compared to alcohol and other prescription drugs. And intentional data collection from states will be important for rescheduling considerations with psychedelic medicines. So I think that's something that we can think about around how anything that we're doing in our state, if something is initiated, how are we going to collect data that not only keeps people safe, helps to monitor public safety, but also potentially is of the type of quality that will help inform kind of federal drug policy reform. Ari, you have your hand up?
Yeah, thanks. Is that last part about how intentional data collection will be important for rescheduling psychedelic medicines? Is that your own analysis, or is that pulled from HHS's own language?
Yeah, I've had some meetings with someone at HHS about this, and we were talking about it in the context of the cannabis program and how the data was collected. And they kind of, I'm not going to throw any specific state under the bus, but there were some states that just had really bad data that wasn't really helpful for them. And so they've mentioned that, like, it's good to do this and have the data collected in an intentional way that hopefully is consistent across states. I think, there are some national efforts that we can get into around data collection to start collecting data from these different psilocybin programs or psychedelic medicine programs. The problem is the data itself cannot be protected by things like HIPAA, which is used to protect all of our kind of, patient data, confidentiality around medical conditions and things like that. And when you're in a state program doing something that's federally illegal, HIPAA cannot protect the data privacy or the confidentiality. So it could potentially put people at risk, or there could be federal subpoenas by the DEA to get data from these programs. And it's unclear if that's going to happen, if that's happened with cannabis. So it's sort of thinking really carefully of, like, how can we get the data we need without putting people at risk?
Right. Okay. So it sounds like this is more of like an inference being made by an official rather than like something explicit where the government itself is like making this recommendation around data collection, more like drawing from the example of cannabis.
Correct.
Okay, super helpful. Thank you.
So the next thing is the FDA issued a complete response letter to Lykos, which means they issue these when they basically reject something in a new drug application. So they did not approve MDMA-assisted therapy for PTSD. They are requesting an additional clinical trial before they will consider approving it again. This was very disappointing to a lot of people, and it was kind of an interesting process to watch because the FDA was kind of changing what they wanted in these clinical trials as they were conducting their phase 3 trials. So it kind of, it was a learning experience, I think, for the other pharmaceutical companies trying to bring new drug applications to market. So the next one that's probably going to get submitted is going to be by either Compass Pathways or USONA institute with psilocybin for depression. And then maybe in a couple of years down the road, we'll see a submission of LSD for anxiety. But I think kind of it's given some people some pause around really thinking intentionally about how to design these trials so that it will fit into this box that the FDA has created to be able to evaluate these things according to their litmus test for FDA approval and rescheduling. And the next thing that kind of impacts our work is the overturning of the Chevron Accord by the Supreme Court. So this reduces administrative power of federal agencies like the DEA. So it may enable more successful litigation of cases or requests for exemptions from the Controlled Substances Act that we might want to explore. As I mentioned before, there's currently an active appeals case happening in the Ninth Circuit Court of Appeals around the Right to Try Act, and for people to be able to, for physicians to be able to give psilocybin to their patients that are in hospice. And so that's pending, and we don't know what that'll look like. Because before, DEA had ultimate authority to say whether this was allowed, and now it will be up to those 3 judges to determine the outcome of this. So we'll see what that looks like. Next slide, please. Okay, so we can stop sharing the screen. And so now that we've kind of given a kind of reviewed what we're doing and how does that fit into the legislation and moving forward, I do want to kind of give a moment and a point to pause and reflect on the work that we're doing. And we have some people that have agreed to kind of talk to us about what's the usefulness of these legislative reports? How can it be most effective for the legislature? And then I know Jeremy wanted to talk about this concept of the playbook that we kind of hinted at earlier in terms of how the report's coming together and how that'll be the most useful. So I think we'll start with Rep. Smith and Rep. West. I don't know if Senator Corrin wants to come on, but if you guys want to come on camera and talk about how the report can be the most useful for you.
I can go ahead and start and then see if Representative West has anything to add. I think this is something I've emphasized before on this task force, but just want to emphasize again that we are not, as a task force, making law in any sense of the word. The legislature is the only place where we make law, and we are accountable to the people. We aren't accountable to this task force. So the recommendations we are making are in no ways binding to the legislature. That doesn't mean they're not important or not helpful, but the legislature will be able to take this report and do or not do what we believe is best for the people of Minnesota. So just like a couple points I wrote down, just kind of keep in mind as we're thinking about this specific report. And the biggest thing I would say is for any legislation, this is probably going to be a starting point. There is a broad range of opinions and knowledge about psychedelics in the legislature now and in future legislatures. A lot of people will maybe know a lot about it, come into this for some specific information or maybe some citations, but a lot of people will know very little about it. You know, their focus is in education policy, but we still have to vote on this. And so they might use this as a very basic starting point to understand stuff. It will be a good starting point as far as areas for action. And I think we've done a really good job of defining that, even in our recommendations of there's decriminalization we can talk about, there's new research we can talk about, kind of each of these little pods that might be areas for action that would be interesting, that absolutely will be something that legislators will look at and say, okay, is this something we do want to do or not want to do? But in that same kind of another caution I would say specifically is, as a task force, I think it would be unhelpful for us to get bogged down in too many details, because no matter what, those details will be worked out by the legislature. So I thought I would just go over the revised recommendation that we're going to talk about later today about removing criminal penalties for possession of personal use quantities of mushrooms that contain psilocybin. I really appreciate sort of the broadness of that, because even that statement alone is going to take a lot of discussion with researchers, with lawyers, to figure out exactly what we want to do. You know, what is, criminal penalties? Okay, we're getting rid of those, but does that mean we still have civil penalties? No civil penalties? What are we going to do with the penalties that are currently in place for people who are currently incarcerated? What does personal use mean? How much of that, as Jessica said, in New Mexico, can it be shared? Can it not be shared? I mean, there's all kinds of stuff that is sort of the area of the legislature that we'll have to work out. that I think this task force, we shouldn't get bogged down. We shouldn't spend time with our recommendations doing that. That is the area of the legislature. So I think just broadly, my recommendation would be, don't think that what we do here is going to be the be all and end all of what psychedelic policy is going to be in Minnesota over the next 10 years. What we are creating is a really helpful and informed starting place for well-intentioned legislators to start this journey or continue this journey if we've already gone down it. And hopefully that's helpful, kind of both in expectation setting, and I think especially as we look at this report that we're going to do, what we're going to put in black and white, to be able to put as much information in there while creating some helpful parameters for those who might not have a background when they read it. Nolan or Rep West, do you have anything maybe to add to that? If anyone has a brief question, also I'm feel free to answer. But I feel like I've said sort of this a couple times, but I think just important to emphasize as we're going towards actually writing the report.
Yeah, I appreciate that, Rep Smith. I think one question, because in the legislation for the task force, we have to come up with a comprehensive plan in the report, yet we don't want to get bogged down by too many details. So I think I'm grappling with, because I feel like I've heard that if the legislature gets the report and it hasn't hit all the legislative duties, then maybe it would not be seen as being compliant with the legislation. So I'm curious how to thread that needle.
I think the term comprehensive plan, at least in my head, is to give some sort of structure for the report, that there should be some recommendations within it of what you see rather than just purely informative. That's how I would interpret that. Because of course, no plan is going to be completely comprehensive, especially when we have so many questions about what the federal government is going to do for, with what we have. So I would say more that is a recommendation towards, recommendations for action rather than just a completely comprehensive, this is what we're going to do for the next 10 years in Minnesota around psychedelics.
Thank you. Ari, you have a question?
Yeah, thank you, Representative Smith. The other question I have is, I totally hear what you're saying, and I'm also grappling with this idea that that the task force will kind of provide some high-level recommendations, and then legislators, researchers, lawyers take over. Is that like this really is the group of experts that the state convened to make a lot of these recommendations, that the expertise that exists at this task force actually doesn't exist among legislators and bipartisan research staff and their lawyers? So like, for a lot of these things, I feel like the devil is in the details, and that like little tweaks and words and nuance really are the thing that can make the difference between a successful policy and not. And so also, like, yeah, do you have any thoughts about how to balance those tensions?
I would just say that's why we're doing the report, and that's why our names will be on the report, who's on the task force, for potential resources in the future. I mean, the bottom line is that the power in our political system is with the people as their elected representatives. So we're never going to get away from the fact that those representatives are going to have to vote on this at some point, and that might, change the face of what those things might be. But that's why doing a task force, I think that's the impetus behind the task force, because exactly what you're saying is that none of us will have the requisite knowledge or know even who to go to with those questions. But now there is a report to go to first off, and names behind that report from there. So did that help? I mean, I know that's not perfect, but I see Representative West is on, so he might want to say something else.
Yeah, that would be great. Yeah, the legislative process is going to do things that make you pull your hair out if you're an expert. Unfortunately, we always make some level of poor decision when crafting legislation, especially on something that most legislators know literally nothing about. So it'll be a struggle, but that's part of, you're a resident of Minnesota. Advocate to your legislator and educate literally the legislator who represents you. And then I think hopefully Representative Smith and I will be helpful to creating good legislation instead of, I look at the medical marijuana bill from years past and go, oh my goodness, what were these people thinking? So we have a little track record I think we can learn off of. But please don't, I mean, especially these are the experts, I would agree, be vocal among your representatives so that they, know what they're doing when they cast those votes.
Thank you, Rep. West. Jeremy, you had your hand up. Did you want to say something?
Oh, I was just going to say, to Ari's point, I think, there's always opportunity in the legislative process, and both on the legislative and the executive branch side for experts, technical experts to come in and advise on the crafting of these pieces. So just to Ari's point about the complexity of some of these things, I mean, hopefully those voices would be incorporated into the process of any development of policy going forward as well.
Thank you, Jeremy. Adam?
Yeah, thank you. Just a question for Representative West and Representative Smith. Our task force officially concludes at the end of the year. And I hear what you're saying, Representative West, that the thing to do is to reach out to our own personal legislators, senators, educate them on this. Do either of you see any possibility of a more formal entity continuing with this task force into the new year, or is it concluding in your mind and then it's up to all of the individual members of this task force to do their own outreach? Would there be any mechanism within the legislative process within the state whereby we continue in some formal capacity? Thank you.
I mean, formal capacity, I would say, anything's possible. Of course, we could convene another task force. I would probably think I would say the next best thing would be for representatives who want to go in this area. Like I imagine Rep. West and I at some point will sit down and say, okay, so what do you think about this, and what do you think is a good way forward, and hopefully have some legislation. But all of that, it's always possible that more things could go forward. But I do think probably the next best thing, like Representative West said, is just advocacy to the actual legislature, especially now that we have a official report.
I agree with everything Representative Smith said. The one thing I would add is once a member of a task force, always a member of a task force. So, use that when you do reach out and you do carry something with being a member of the task force. People will give you more weight to your opinion, I would hope. But as far as a formal thing, Representative Smith is right. It's very, very unlikely we're going to be doing anything super formal. But if there is a bill and it's moving through the process, literally any member of the public can testify. You can email the members of those committees. You can talk to us and see what we can do. But that would be the route forward. But yeah, once you're a member of a task force, you can put that in your signature line forever.
Yeah. Thank you both. I think it's a really important conversation. I appreciate it. Thank you.
Thank you, Adam. And Rep. West, Guthrie?
On a lighter note, given the fact that we're all on the task force for all times, it would be great if someone could make and supply t-shirts to the group, so that way when we'd approach our legislators, we'd have some proof that we're actually on this task force. Thank you.
Thanks, Guthrie. Any other thoughts? I know, Jeremy, you wanted to talk about the notion of the playbook.
Sure. I mean, I think it's maybe a variation on what Representative Smith said, but I really first want to just express my appreciation to you, Jessica, and to all the folks who put a lot of time and effort and work into really coming up with a lot of good information for us to review. And I really think about the report. And sort of going back to this idea of comprehensive, is I really feel and look at this report sort of like a playbook that offers a lot of different alternatives and pathways that the legislature could choose to go down, and they can kind of decide which plays they want to call out of that playbook, but that the report itself has a lot of that basic information and a lot of the analysis. And this is a dynamic changing space, which I think we all know too, but as a document that really outlines the different ways the legislature can go, I think the final report is going to be deeply valuable to moving this discussion forward and keeping these conversations going next year and on into the future. So I just want to express my appreciation for that and kind of how I view this report.
Thank you, Jeremy. All right, any other thoughts about this? I don't know if we want to get like the Senate perspective from Senator Corrin.
Hello?
Yeah, Donovan.
Sorry, I can't find the little hand thing, so. Being the Ojibwe outreach personnel, how are we going to ensure that we have our native voice collective besides Guthrie and I continuously, doing the communication, doing the outreach, bringing it back to the task force? Is there going to be other methods or avenues, or do we just continuously ask or advocate to our population to do the outreach? Is that kind of like how you envision it working?
Donovan, is that a question for the legislators?
Yes. Sorry, legislation.
I mean, I hope we can be a tool for you as well. Now, because it can be intimidating to say, yeah, just reach out to the legislature, and well, which member of the 134 that are in the House do I talk to? Hopefully now myself, Rep. West, can be sort of a first point of contact, and then obviously your local representatives should be as well of, hey, this is something we're concerned about, or my community is thinking about this, or hey, I saw the bill and what about this? I mean, those are conversations that we want to have, that I think is helpful to have.
Yeah, and I would say the tribal communities also, if they want to advocate, they have a lot of lobbyists. So this could easily make it on to an agenda item for any number of those. And they do powerfully advocate for their clients.
Thank you, gentlemen.
All right, are there any other questions or thoughts around this topic before we move on? Oh, is that you, Stacy?
That was me. Yep.
So I think we might be due for a break if there's no other points of discussion on this. If everyone agrees, then we'll take a 10-minute break and we'll come back at 10:36. See you in 10 minutes. All right, it's 10:36. We're going to get started. Everyone can come back to their desks, computers. All right, so now we're going to move on to the next two votes that we need to do around some recommendations for the report. So we had some weird wording in the last versions of these recommendations. So the work groups spent some time last month kind of rewording some of these things so that they're more clear. And now we're going to come back and vote on them. So we have on the slides, which you'll see on the screen, as well as the slides that were shared out, kind of what the language is of the original recommendation that folks voted on and the revised one that we're going to vote on today. So the original recommendation was kind of the task force recommending removing criminal penalties for possession of personal use quantities of psilocybin containing mushrooms, as well as the synthetic psychedelic medicines for psilocybin, MDMA, and LSD. And there was some confusion around having those two lumped together with the synthetics and the naturals. So we created this new one, revised recommendation 1, which we will vote on, that the task force recommends the Minnesota legislature remove criminal penalties for the possession of personal use quantities of mushrooms containing psilocybin. So we're going to do a voting activity over on Mural, but I want to first see if anyone has any questions about this recommendation before we move on to voting. Yeah, Renji?
I just want to point out to the members that are watching and participating that this revised recommendation is for the possession of personal use quantities of mushrooms. So these are naturally grown mushrooms, not synthetics containing psilocybin. So these are not open to individuals that are synthesizing psilocybin, correct?
Correct. This would just be for possessing and using. Yeah, Adam.
And similarly, just going back to our last meeting in September, there was a resolution we voted on regarding sharing or cultivating, but this proposed recommendation is just personal use. It's limited only to personal use. Is that accurate?
Correct. We have two recommendations we're voting on. One is this one, and the other one is this, in addition to whether we also want to allow cultivation and sharing, because before we didn't explicitly remove criminal penalties for possession and allowing cultivation, so it would have created a weird thing. So yeah, there's this one that's just possession, and there's another one that's possession and cultivation and sharing that we'll vote on after this one.
Thank you.
Any other questions? Thoughts? Donovan?
Does the next question have the personal use quantity?
Yes.
Okay, thank you.
So this one would basically allow people to have mushrooms, use them, possess them, whatever the personal amount quantity would be up to the legislature, but it wouldn't allow people to grow and share. So there's another one that would have all of that in it, plus the ability to grow and share. That's a separate vote. So we're just going to vote on whether we want to allow people to possess and use personal use quantities. And then we'll come back and we'll talk about the next one that allows cultivation. Stacy, do you want to?
I am ready whenever you think we're good to go.
Yeah, if there's no other thoughts or comments or questions, then we can move on to our vote by roll call on this recommendation that we'll do over in mural. Or we're doing a vote by roll call and tallying the votes in.
Correct. Yep. Nick will put the totals in on the sticky that's right to the right of this recommendation. And I'm going to just use first names here. So keep your finger by your key. And so the new recommendation, the task force recommends the Minnesota legislature remove criminal penalties for the possession of personal use quantities of mushrooms containing psilocybin. And Courtney, your vote?
Well, hold on one sec. I think we need to, just for the new members, we didn't go over the 2 slides. I didn't see them there. So there's the initial voting process review, and just so that people understand what the abstains mean. Right. So at last meeting, we decided that abstentions don't count towards the total for the supermajority. So to vote yes, no, or abstain are the 3 options. And just knowing that the abstains vote don't count towards the total. Okay, sorry. Take it away, Stacy.
No worries. No worries. All right. Courtney.
Yes.
Hang on. Helen? Helen, are you there? Guthrie.
I'm sorry. Well, sorry,
are you there,
Stacey.
Helen?
I am, but my cursor was behind this new slide. So
Oh.
that's a no.
That's a no. Thank you, Helen. Guthrie.
Yes.
John.
No.
And Paula's gone. Jeremy.
No.
And Stefan, have you? I just want to check in again on Stefan. Has anybody seen him?
I don't think he joined today.
Yeah, it's just
he can submit his vote.
Yeah,
No?
he just wasn't sure. So, okay. Margaret.
Yes.
Bennett.
No.
Senator Corrin. Mark. He must have been pulled away. Nick.
No.
Ari.
Yes.
Jessica.
Yes.
Kit.
Yes.
Jill.
No.
And Ken Sass was going to be absent. His vote, though, was no. Donovan.
Yes.
Rep Smith. Andy.
Yes.
Michael Tabor.
Yes.
Adam.
Yes.
Raji.
Yes.
Reps West. Nolan.
Yes.
There we go. Thank you, everyone. Back to you, Jessica.
Thank you, Stacy. All right, so now we're going to move on to the second recommendation that we're going to vote on, which is very similar to this one in the wording. And so the initial one that we voted on last month, there was some confusion because there wasn't an explicit language around removing criminal penalties for possession while also allowing non-commercial cultivation and sharing of psilocybin mushrooms. So we've clarified that so that it's all lumped in together. So the original recommendation was the task force recommends the legislature remove criminal penalties for the non-commercial without remuneration or money cultivation and sharing of psilocybin mushrooms. The revised recommendation is the task force recommends the Minnesota legislature remove criminal penalties for the possession and personal use quantities and non-commercial without remuneration cultivation and sharing of psilocybin containing mushrooms. Guthrie, do you have a question?
Yeah, thank you. Can we get a total on the last vote to see if we have a super majority? As this really, how can we make a recommendation for this if we didn't approve that?
Yeah, that's why we kind of lumped it into two. Like, are people okay with possession and use? But are people okay with that plus cultivation and sharing? So I don't think they're mutually exclusive. It's just if this one passed and the other one didn't, then this one still allows possession as well, I think is the.
That helps.
So I don't think they're mutually exclusive. I think just one was like last month we were like, let's remove criminal penalties, but then there wasn't that additional distinction around possession. So people, because that one didn't pass, but then there was more support for the mushrooms and cultivating, but they wouldn't be allowed to possess. So then they could grow them, but then having them would not be decriminalized. So it didn't make sense. So we've just made it make more sense right now. But they are very similar, with one just allowing cultivation and sharing. Does that make sense?
That helps.
Any other questions or thoughts about this one before we vote? Okay, Stacy, I'll turn it over to you.
All right. Hang on just a minute.
And I don't know if we got an answer to Guthrie's question around what the total was for the first one.
Yep, we put it on the sticky next to the first vote. So there's 12 for, 7 against, 0 abstain, but we still are missing 2 votes from Stefan and Senator Corrin.
And
So we
Paula,
don't have a
did Paula submit a vote?
Pardon?
Paula is also missing today.
Right, but I included her. She's a yes.
Okay, we got her vote. Cool.
Yep. Okay. All right. So we're on to the second recommendation.
That should be 13 then. I didn't count her vote.
Very good. So we got 13, 7, and 0 abstain. So recommendation 2, the task force recommends the Minnesota legislature remove criminal penalties for the possession of personal use quantities and non-commercial without remuneration, cultivation and sharing of psilocybin containing mushrooms. And we'll begin again. Courtney?
Yes.
Helen?
No.
Oops. Guthrie?
Absolutely, yes.
John?
No.
Paula is a yes. Jeremy?
No.
And Stefan will pass on for now. Margaret?
Yes.
Bennett?
No.
Mark? Senator Curran? Nick Leonards? Nick?
No.
Ari?
Yes.
Jessica?
Yes.
Kit?
Yes.
Jill?
No.
Ken? Oops, Ken's absent. And, oh, let me correct that. Ken's absent, but his earlier vote was no. He sent that in ahead of time. My apologies. Donovan?
Yes.
Andy?
Yes.
Michael?
Yes.
Adam?
Yes.
Raji?
Yes.
And Nolan?
No.
All right. And Nick will do the count up and put it on the sticky for everybody. But remember, we are still missing a vote from Stefan and Senator Corn.
Yeah, did he drop out of the meeting? We have to get a hold of him. He's still listed as being on the meeting.
Yeah. So he must have gotten pulled away somehow. All right, back over to you, Jessica.
Sorry, this is Bennett. I have one quick question for Stacy. Did Ken's vote in the previous recommendation get tallied as part of the total?
You mean from last week, Bennett?
I mean from our first vote from a few minutes ago. You mentioned in vote 2 that he had sent in a vote ahead of time, but I wasn't sure if that was included in the total for vote 1.
So I'm counting, and as is Nick on our team, to do a double check. So, and then Nick puts it on the thing. So give us a minute to cross check our lists behind the scenes, and then we'll interrupt again and make sure that we've got it right. Sound good, Bennett?
It sure does. Thank you, Stacy.
You bet. And while we're doing that, I'll turn it back over to you, Jessica.
Yeah. Let's see. Just looking at some notes. Give me a second. I mean, so this is kind of bleeding into the next phase of our meeting, which is talking about the report and kind of how, you know, after looking at all the results of the recommendations and thinking about this playbook concept, how might each of these recommendations be presented in the report in order to be most use? Does it matter the order that they're placed in the report? Is there anything else related to recommendations that were not approved? So I think in the report, we're thinking about, like, do we want to have all of the recommendations in the report and kind of talk about how they could be rolled out is in this kind of playbook fashion. And then there's also all these appendices in the report around, you know, there might be some things that aren't necessary for the main meat of the report, but there's a lot of appendixes so that people can put a lot of useful information in there that can be referred to. And currently there's a section on recommendations not approved. But we are kind of talking about all of them as this kind of broader thing to think about over the next 10 years or so. So just curious where folks are thinking about that. And maybe this is a question for Rep. Smith and Rep. West around if that even matters in the report in terms of the order.
Maybe only to say that I think it would be rare for someone to just sit down with the report and go from the beginning to the end. Generally, speaking from personal experience, you have a question, you look for it, and then you read the section, you know, that pertains to it. So I don't know how important it is, but that's just like a personal from task force reports that I've used in the past. That's normally how I use it.
Yeah, that's all I would have to say as well.
Thanks.
And this is Stacy. Nick and I just double checked both of our separate lists for voting tallies, and what you see on the mural sticky note is the right one. 13 yes, 7 no, 2 votes missing.
Thanks, Stacy.
Yep.
All right. So I think we're going to move on now. I'll turn it over to Caroline Johnson, who's going to talk about our report writing.
Excellent. Thank you. First of all, I apologize about my camera being off again. It was working just fine until about an hour ago. My poor little computer can't handle too many things happening at once. So I'm just leaving it off for now. But we do want to spend some time kind of checking in on how the report writing and reviewing is going. This section will have a lot of opportunities for discussion, just to make sure everyone's on the same page. So be prepared for that. We can move to the next slide. So as a reminder, for those not involved in writing, the due date for the first draft of each section was September 27th. The first round of review is hopefully well underway, since the deadline for that is tomorrow. And then the next deadline is October 18th for a revised draft of each section, which will essentially be a full draft of the report. Next slide. And so here's kind of the larger timeline, just focusing on the report for our remaining time together. So during the rest of October, the draft will really come together and it will go through the MMB copy editing process. We can kind of discuss it and any feedback we get, mostly on formatting and accessibility, things like that, at the November meeting before sending it through the MDH copy editing process in early November. We'll aim to submit it for review there by the end of the week of our next meeting. So kind of November 7th or 8th to kind of get everything in order. And then at the December meeting, we can discuss any, formatting edits that may have come back from that. And then we can continue, polishing and refining the report. Next slide, please. So as the report is being constructed, we want to check in on if everyone's feeling like it's meeting the legislative charges, which, as another reminder, are the scientific, legal, regulatory, and policy components. I know there's really only so much regulatory and policy work that we can consider at this point, but we really just want to gather everyone's thoughts on if you feel the report is heading in the right direction, and if it's not, what could be done to kind of get it more aligned with your understanding of the legislation. And so I think even if you're not working on writing or reviewing the report, everyone has been immersed in these discussions for just about a year now. And we've had a couple of months to digest the outline and the discussions around it. So we do want to check in with everyone. So we'll pause here kind of quickly to discuss if the report is meeting expectations so far, and if not, what could be done to course correct. We also have on the mural, the first box under section 3 is available for you to put stickies with your thoughts in it, but we'd certainly encourage a discussion. So I'll open the floor to everyone. Nobody? Everything is perfect?
I'll start. So I've been working a lot on the report, and I think it's coming together well. I'm personally kind of just been dumping a lot of facts and references and things like that. And admittedly, I've been having a bit of writer's block. I was very grateful when I saw Courtney's draft come in for the clinical program. For the recommendation. And so I think that it's a really good template for, I think, how to structure each recommendation. So thank you, Courtney, for submitting that. And I know Paula DeSanto put in a piece of writing for the recommendation for adult regulated use. And then there's just the sections on the removing criminal penalties, as well as, sorry, I'm spacing the research, more research. So I think it's coming together well. It just needs a lot of massaging and narrative building. But yeah, so I'm feeling okay about it. Just kind of curious what other folks are thinking about if they've looked at it. Adam?
Hey, yeah, I'm feeling good about it too. I've reviewed about the first third of it, just going through reading it, and we're in a good position. I'll continue working on it tomorrow to hit our review deadline by October 8th. I'm happy with how it's coming along. Thank you all.
Yeah, thank you, Adam. I've appreciated your comments on the draft. Yeah, Courtney.
Thank you so much, Jessica, for all your work. I haven't had a chance to review or I have, but I haven't had a chance to make any comments. So I will also do that. I'm having some, well, actually, yeah, that's all I'll say. I'll email with other questions.
Thanks, Courtney. So Caroline, I know you were trying to get a sense, and I don't know if this is a mural activity of kind of whether we're actually hitting the legislative charge. you know, and if we're on track and task and being compliant with what the legislation has asked us to do.
Yes, we do have a mural activity for that. In case, Michael, go ahead.
I was just gonna say that I'm working with Raji and for the community research section, and if anybody else has, I kind of volunteered to kind of spearhead that area, and then personal narratives or anecdotes. I mean, but if anybody has other things they wanted added in the community research section, they can forward that stuff to me. I try to organize it as best I can, and then hopefully we can all kind of tighten that up together. But yeah, that's kind of a quick update there.
Yeah, thanks, Mike. Can you clarify what you mean by the community research section? Because I thought Caroline had already written that one. Are you adding stuff to it?
I'm actually just looking at the draft right now. Maybe it's what Raji, could you maybe what section would that be under? I might just be using the wrong.
Is this related to the anecdotes of like getting the feedback from the community?
Yes,
Yeah.
Jess.
Yeah, so we have a section that's sort of like personal anecdotes. So there's one where it's personal anecdotes for each task force member if you want to share either your experience on the task force or your experience with any psychedelic medicines. And then there's another section under that that's for any community feedback that you've collected that you want to share. But at our last working group meeting, we discussed this issue. I mean, there's some data privacy laws in this state and around, you know, informed consent of what you're sharing, and has somebody given you an explicit written permission to share that information as a quote. So I think we decided if they're quotes from people, we need explicit permission, even if you're not naming them. Otherwise, taking that public feedback and maybe organizing it into some themes that can kind of help conceptualize what each kind of community group is thinking about this. Adam and then Renji.
You might have hit this, Caroline, but what's the due date for personal anecdotes? And is there any guidance on a personal anecdote, like how long they should be, or any other guidance? I know Mike and I are exchanging emails about this, but I don't know kind of what the guidance would be for those.
So I'm going to get into details on this in like, I don't know, 2 or 3 slides.
Okay.
So we'll
Thank you.
cover that in a second.
Renji, did you have something to add?
Yeah, I just wanted to add, Jessica, that's exactly what we talked about. And the feedback that I provided Mike had de-identified any sort of specific responses and provided general themes based on the 2 different groups that were asked. So yeah, no personal anecdotes that can identify anyone, no quotes, no names.
Great, thank you, Renji.
All right, so if anybody has any last thoughts on if it's meeting kind of our legislative charge, we can move on to the next slide, please. So we next want to see if anyone who's been working on the report feels like they might need any additional information or data from other members or the seats they represent. And similarly, if anyone thinks that they might have some data that would be useful to contribute, even if you're not an author or a reviewer, now would be a really great opportunity to connect. So we're going to pause here again for a minute and open it up to allow time for that connection of resources. This can also include, figuring out what might be the best way to get data from other members. How much time someone might need to get that data. Like if you have a specific request for somebody, they'll need some time to gather it. Kind of how best to get a hold of each other, kind of the practicalities of any resources that might need sharing at this point. So on the mural under section 3, again, you'll see the middle box where anyone can add a sticky on what kind of information you think you need, who you think could help with that. And you can also include maybe a sticky for the best way to contact you if somebody needs data from you or those you represent. So we're going to pause here again for the discussion around the connection of resources. And I thought I saw your hand, Guthrie, but it is down now.
Yeah, just checking. Are we going to talk about this out loud, or are we just throwing down stickies on the mural?
I think both. I think talking about it is a really good way to do it, but then having stickies as a reminder if people need to come back and check the notes.
Sure. Yeah, I do have a question. If I can just get it out there real quick, and I can drop a sticky for it as well. You know, thinking back to what Representative Smith was talking about earlier in terms of our, limited capacity for influence. For folks coming from the tribes, it would be good to know if either the legislators or state agencies have a list of districts that have tribal lands within them. So that way we can provide that within the tribal piece of the report.
Absolutely. That's great, Guthrie. Thanks for bringing that up. Margaret, I see your hand.
Yeah, I am just wondering because some of the feedback in the section that I was working on said, oh, this was covered in this section or it's also covered in this section. And because I was only on one section, I'm wondering who is looking at it as a whole complete document so that we can see the flow. Is that you and Jessica? Is just because I got kind of myopic and then didn't realize that other parts of that were covered in other sections.
No, for sure. That was why I left the comment, just because I figured people are so absorbed in what they're writing right now. So just kind of a little pointing to that. And if you feel like it's best to leave it in that section, feel free. This is your report and what you think is important goes into it. But yeah, so right now, kind of the bird's eye view is me and Jessica, at least. And I think Jess is kind of overseeing as well.
Okay.
Yeah, thanks, Margaret, for bringing that up. I think there's a lot of kind of redundancies that we're finding and just trying to be like, oh, this could probably go here. This could all be referenced in an appendix, so we're just trying to clean it up and getting everything in there, identifying redundancies and then tightening things up.
One thing maybe just to keep in mind, this is Jeremy, excuse me, is based on how Representative Smith and Representative West described how they read these reports. It may be some redundancy may be useful, and I know that might complicate things a little bit, but given that folks might just read specific sections but not the entire report front to back, there may be some use for calculated redundancy.
That's helpful. Thank you.
Yeah, I would echo that. That is, I think, calculated redundancy is a good way of saying it. I think that'd be good to have in the report.
All right, I see a number of stickies, which is fantastic. If
Most of
anybody,
those are...
oh, well, that's great. Thank you for adding them. Do you want to talk about them at all so that maybe people who can't see everything at once know what's going on, or if anyone else has added stickies, just kind of discussing it might be helpful for the public as well.
Yeah, I can touch on a few things. I've just been kind of compiling questions that I've been having and how to get some solutions to them. So one is we've talked about and again, this is probably up for the legislature and maybe this doesn't need to be in the report, but we've heard potentially some permissibility with the Office of Cannabis Management to house anything that might continue this work. And I know they're still trying to get propped up. So it's trying to figure out what does that look like? What's their perception about it? Does that make sense? So that's one question. Another thing I'm grappling with is exploring the one of the things that we're supposed to explore relating to resolving conflicts with federal law and requesting an administrative exemption to the CSA. So I heard that in either the last session or the one before that this did come up in the context of the cannabis program. And I think there was some concerns around whether that would impact people's Second Amendment right. if they're engaging with a, controlled substance that's federally illegal. And there was somebody that said maybe we should request an exemption from the Controlled Substances Act so that doesn't happen. And so I don't know, I think I saw that it was something introduced by Senator Curran. So I don't know if there's been any developments on that. Has there been a request made? I also asked Bennett about this. Has the Attorney General's office ever tried to request an exemption, or has the federal government tried to subpoena data from the cannabis program? So these are just kind of questions I'm thinking about. What do those interactions actually look like with the federal government, with the DEA around some of these exemptions and the programs that we have in the state right now?
On questions related to OCM, I might suggest reaching out to OCM directly to get their perspective. Sophie Leiniger is their government relations person. I can share that information, but she might be a good contact to resolve some of these questions if they're out there.
Yeah, thanks, Jeremy. I think we did reach out to them several months ago, and there was interest, but they were kind of bogged down trying to get their whole department up and running and staffed. So they kind of said, well, can we talk about it later? So maybe we can just reignite that conversation. Thank you.
Okay, does anybody else have thoughts? Any information you think you need for writing or reviewing? Okay, hearing none, we'll move on to the next slide. But I do want to remind you, this will be open throughout the week. So if you think of something, feel free to put it in the mural, but do reach out to whoever you need it from as well. Okay, this slide. Kind of a specific question that has come up is, how long do we want this executive summary to be? There's a number of sections in there already, and it kind of mirrors the report as a whole. And so task force input on kind of depth of content and length of that section could be really helpful for Jessica. And piggybacking on this, since Representatives Smith and West indicated that we really shouldn't get bogged down in the details, what does the task force think is maybe the most efficient way to convey any specificities without getting too deep? Do you just want to point to references, like include them in there? Do you want to lean heavily on appendices? If so, how big should they be? There's a number of them in there already, and they're pretty lengthy. But I think maybe this is a good point for us to have the discussion of kind of what we want it to look like from a high level view and where we want to house details. And again, maybe it could be a useful place to hear from our legislators on kind of the best way to include a lot of information in a very concise way. So I'll start off with Ari.
Sorry, I didn't mean to skip over the legislators. I was just going to add very briefly that I don't think the executive summary should be more than like 4 or 5 pages long. And I think it should focus on the recommendations and not do a whole lot of process. Like, this is the task force, this is how often we met, kind of put all that stuff in the report, in the body of the report itself. But I think like just get to the end, with some strategic context around it, but I think not more than 4 or 5 pages. And I think some of the conversation in the margins that we had about intro, about like, the long hundreds-year history of psychedelics use and the war on drugs and what we can learn from cannabis, I think all that stuff goes in the intro to my mind. Yeah, that's what I'm thinking. And I don't like the report that I wrote and submitted to the legislature earlier this year. I think got pretty good feedback, and Jess Burke, I can send you the link if folks want to see the executive summary in that and what we did there.
Excellent. Thank you, Ari. Okay, any other thoughts? Does anybody have thoughts on the appendices? Because right now they contain all the details. Is that something, for example, that legislators would find helpful to kind of have a high level overview in the body of the report, and then just a whole bunch of specifics more resources where they could go to find this information in the appendices, or is that maybe not even necessary?
It's a hard question to answer because I think every legislator is different. I will say merely from my experience, generally, yeah, executive summary is very quick, is very helpful, and then detailed appendices of some kind or footnotes I find very helpful. If I have a very specific question or I don't understand one concept very much, then I can go to those places, but don't necessarily have to if it's something that I do know about. So I think short executives or short summaries and then with larger appendices is the way to go, but I'm just one legislator.
Ari, go ahead.
Sorry, I have another opinion on this. I just want to share that we should also remember that this report will be a useful advocacy tool for communities as well. Like it will be part of legislative history, publicly available. So to the extent that we should include more there too, that advocates can leverage whenever down the road, I think we should be more inclusive.
Yeah, I think that's really helpful. And I think Caroline and I have talked about like that MDH has some ideas around like keeping the main report short enough, so it's easy to read, it's digestible. And then we can have a lot of those resources and things that can live on, for advocacy and education and ongoing legislation that wants to tap into that in the appendices, so that the report itself is pretty concise and to the point, which hopefully would be the most effective. And if people want to get into the weeds, I mean, we do this in scientific publishing, right? You publish a little short paper and then you have a 50-page supplement with all the details for the nerds that want to look into it. So I think we can structure it like that. Yeah, Adam?
Yeah, just generally on the topic, there are many points within the draft so far where Caroline poses a question, should we put it here or should we put it in the appendices? And I think every time I suggest putting it in the appendices, just generally with the goal of, like you said, a short, concise report, and then all sorts of tables and lists and other information could be in the appendix. That'd be my personal vote.
Or footnotes. Love a lengthy, spicy footnote.
Yeah, we talked about the idea of footnotes versus references, and I think there's an accessibility issue around footnotes for MADs. Jess, correct me if I'm wrong, that it just creates a problem for text readers for accessibility.
Correct. Yeah, there's for people who use screen readers, the footnotes can get really wonky in a PDF. So we've started to just avoid them completely and do inline references in text. And I also just, as long as I'm off mute, the link to the report that Ari was talking about is in the meeting chat. The link to the team's version of the task force report is also in there if you don't have it handy.
Thanks, Jess.
All right. Any other thoughts, questions, comments on kind of the structure of the report and the appendices? Okay. Hearing none, we can move on to the next slide. So here's where we can get into the personal anecdotes, or the testimonials. So first, we'd like to remind members who are interested to send a paragraph or two or three along by mid-October, probably aiming to have that like completely finished by the 15th at the very, very, very latest. We've extended this deadline from last meeting just to make sure that everyone who wants to provide input has more of a chance to do so. And so as I understand it, you'll want to send that to Mike Tabor, who will compile everything and get that to us and get it into the report. There was also talk about kind of including some input from your communities or the public email inquiries. So, we on this end don't have the capacity right now to compile that. But again, this being your report, if you find that you as members have time to collect and create a cohesive input for this section, which we've already seen, I think Paula has submitted kind of some community testimony. So if you want to do that, you're absolutely welcome to do so. But again, do remember to use best data practices. I want to reiterate, no identifying information or direct quotes without getting informed consent ahead of time, which includes if you're looking at the emails. And so in the draft report, Jessica provided a link to the Minnesota Government Data Practices Act in a comment. So you can look through that to learn more about it. If you can't find that comment, reach out to any of us and we can send you some information about it. But I think we'll open this here to kind of let everyone discuss the personal testimony section, how you want to format it. Again, right now it's kind of set into, here's the input from the task force, and then another section for here's input, kind of aggregate input from the communities that are represented by the task force seats. There's really no specific mural activity here, so we'll just kind of have a discussion about that. No questions? It's all clear?
I kind of want to talk about the paragraph or so. I don't want people to think they can only submit a paragraph. I know that there's been one anecdote put in there that's longer than that. Mine is longer than that. I think if it's in an appendix, I don't think we're limited to page numbers. So I think speak your heart and speak your truth. But I know I have to edit mine because it was like 4 pages long and I need to cut it down.
Yeah, absolutely. Don't want to limit you if you say what you need to say. That was just kind of my initial thoughts because that's just how I structure it. But yeah, include what you want to include. Anybody else? Any practicalities that we need to think of? Is there a best way? I think everyone is, Mike kind of is spearheading that. So I'm assuming email is the best way to get that to him.
Yeah, for sure. And then I was going to say, we talked about this in a smaller work group meeting, but we've kind of been using another report as an example. It was based on an Alzheimer's report, but looking at what Ari just sent over, I highly recommend we use that as our example, as opposed to that other report that we were looking at. Looks way more organized, and that's just my personal opinion. And yeah, if anybody has any stuff we were talking about, just go ahead and email that to me, and I'll do my best to kind of organize that and put that into a separate section.
Excellent. Thank you so much. Okay, do we have any more thoughts, questions, comments on this personal anecdote section? All right, hearing none, we can go to the very last slide.
I have a question, Carolyn.
Yes, go ahead.
So is there any part where we could add the traditional medicines acknowledgement for indigenous populations?
Yeah, absolutely.
Would that be under tribal sovereignty, or would that be just another area?
So right now we have a kind of a brief paragraph on Indigenous ways of knowing in the community research section. This is something that you could include there. You could create your own kind of section within that community research section to include tribal considerations. You could include it in the tribal sovereignty section. There's really, wherever you feel like it best makes sense to get the information to our legislators, that's entirely up to you where you want to put that.
Thank you.
You're welcome.
And Donovan, I do mention this in like the intro. So it's in there and we can maybe infuse it in different recommendations as well. If that would be helpful.
I seen the bit. Thank you.
All right. Any other questions? Okay, so we'll get into just the logistics kind of behind getting this all together. Not on the slide, but it's helpful to write your sections maybe in your own Word doc or Google Sheet or whichever format is comfortable with you. Just kind of for version control and to make sure that nothing like funny happens with the main document. No accidental deletions or formatting issues, kind of technical things like that. But once you have your draft, you can either send it to us to put into the whole draft for you, or you can put it there yourself if you're comfortable with that. I don't know who all has editing access in the Teams folder, but if you find that you don't and you need it, you can either talk to Jess, or again, you can just send me your final versions. And remember that I'm here to kind of also include any questions you might have about the writing process as best I can. And that Jess included a really helpful writing guide in the Teams folder. I see Courtney's hand.
Thanks. Yeah, I was just curious now. So now that mine's been put in there, if I'm going back and find things I'd like to add, do you want me to continue to work on the draft version and continue sending it to you, or just go in and edit in the actual document?
I'd say go in and just edit in the actual document. Just making sure that you have Control-Z ready in case something gets deleted or something. But yeah, you're fine. Jess?
Everyone right now has editing privileges because I couldn't figure out how to change that on Teams on the fly. But if you're not a writer or an editor, again, like this is going through the copy editing process a couple of times. So we're not looking for folks to be making, like word choice, wordsmithing changes. It's mostly if something's wrong or something's missing, leave a comment. So I might change it to if I can kind of get in there and have some time to go through everybody who's not a writer or a reviewer, to change your access to that document just to be like reviewing and commenting. But right now everyone does have editing privileges, so just be careful, I guess.
Thank you, Jess. Courtney, do you have another question? Is your hand still up? Okay, cool. Okay, so before we end this section, some very last thoughts. As the report is coming along, we really encourage you to be as concise as possible. Move things to and then reference the appendix if your sections are getting too lengthy or too detailed. And keep in mind that while this is a legislative report, it's also available to the public. And so writing in a way that's accessible to a diverse audience is really important. So write in plain language as much as you can, include definitions, kind of make this easy to access for the public. And then finally, if there are any other questions or clarification needed on constructing the report, we can discuss them here. You can place them in the last box on the mural under section 3, which is just kind of a general catch-all for thoughts and comments. And then all of this will remain open, through the week, so you can kind of add things as needed. And you can email me or anyone on the leadership team as questions arise. So I'm going to open it up one last time for any kind of lingering thoughts, questions, or comments before we move on. Okay, hearing none, I will hand it back over.
Thanks, Caroline. Let me just check with our agenda real quick. So many documents open. Let's see. All right, I think we might be closing up. We could potentially be ending early today. I don't know that we have much more to discuss other than this. I don't know, Stacy or Jess, do you think there's anything to All
I
right.
think we can just close things out and remind people that work group meetings are the second and fourth Thursday of each month, unless otherwise noted. The next actual task force meeting is Monday, November 4th. And that's all I've got. So unless there's anything else the MAD team or the others need to share, I think we're good to go, Jessica, and you can close this meeting out.
Yeah, thanks. I think if we could just get a summary of what the final vote tallies are with now that we have DHS's vote for the ones we did in September plus today's, just because I'm putting the percentages in the report to just kind of highlight how each of those landed. So I think we're still waiting on Stefan's vote, but otherwise we should be good.
We're just waiting on Stefan's vote. So the recommendation revised number 1 is 14 for, 7 against. Revised recommendation number 2, 13 for, 8 against. And was I hearing maybe Jess's voice earlier? Was there, did I hear that right, Jess?
Yeah, I was just gonna say we updated the totals. Did we update the last month's mural? Vicky's, Nick, with?
No, haven't
No?
updated
Okay.
last month, just these 2 revised recommendations.
Hi, and this is Bennett. So for these 2 vote totals, the only I know we've had some people who've emailed in votes, and we've had some people who weren't there for the original vote earlier this meeting. I just want to confirm that these 2 vote totals are everyone except for Stefan.
That is correct, Bennett.
Okay. Okay.
Yep. Yep.
Yeah, so I think as it stands now, so last meeting, we kind of were hanging, there was one recommendation that had achieved a supermajority pending 1 vote. So I think we're in that situation again with recommendation 1, which as it currently reads is a supermajority, whereas the recommendation 2 is not. So we're still got to wait and see for this 1 vote. But ultimately we're describing all the recommendations in the report, and then we'll just report kind of transparently what the votes were and what our discussions were about it. So those of us that are going to be writing are going to be hunkering down for the next week or so, getting this done. I know I am. I'm going to be focusing primarily on this for the next week. So you might be getting some random emails from me. So just stay tuned if I have some questions or thoughts that I might be spamming you with, hopefully not too much. But I appreciate everyone's help and support through this process. Anything else we want to touch on before we close out, Stacey?
I just want to clarify, is there another work group meeting on the books right now, or is that work finished for now? And
we have a meeting scheduled this Thursday. I think it would be good.
There is for sure.
Want to attend, especially the people that are writing and people that want to have input on the recommendations and how they're described coming to the working group so we can kind of solidify that up. So that's this Thursday at 4 p.m. Central Time. Jess and then Bennett.
We will, now that we got the DHS folks late last week, we'll update last month's meeting summary and get that out as soon as possible.
Great, thank you. Bennett?
Just so that we aren't in the position we were over this last month where we were waiting on the final vote until we got one outstanding determinative vote, we should be sure that somebody is reaching out to Stefan to get his vote as soon as possible, and that the results, also we should be sure that the results are then communicated to the task force as soon as possible too.
I'm reaching out to Stefan.
Jessica and I are in contact with him. I'm just waiting for his response.
Oh, great. Okay. Thanks, Jess.
All right. Thanks. So I guess we'll officially adjourn an hour early, which I think is a first for us. So I think amazing. We can all get back to our Mondays, our lovely Monday. Where is that? Yeah, so like we said, the next working group meeting will be on Thursday. Depending on whether we need to continue doing that work, there'll be another meeting 2 weeks after that, same time, same place. Yeah, and just, all of us that are writing, be in communication with each other about things you need and things that need to get tightened up. As always, you can reach out to all of us on the leadership team. Jessica Burke has her email listed. There's opportunity for member feedback if you want to keep putting stuff into Mural today or throughout the week. And just a reminder that our next full task force meeting will be a month from now, Monday, November 4th, the day before Election Day. Be an interesting day. Bennett, is your hand still up or is it?
I'm sorry. No, I just forgot to lower it.
Okay, cool. All right, so with that, I think we'll adjourn. Thank you everyone for your attention. Thank you to the public on YouTube for watching. Thank you to all the members and support staff for helping make this meeting run smoothly. And we'll see you in a month or some.